There you go. Hey, May is Stroke Awareness Month, and we're taking a look at the warning signs and what we can learn from the recent deaths of Luke Perry, Director John Singleton, dying at 51 years old. We're joined by Dr. Sanjay Anandaram. He is a neurologist at Rochester General Hospital. And Doctor, we were discussing how we're seeing, this younger set of victims of stroke. Luke Perry, of course, and John Singleton, but also Emilia Clarke from Game of Thrones, who survived a stroke. Why are we seeing younger patients these days?
Well, there are a number of risk factors for stroke.
Okay.
Some of them certainly are familial or genetic, that can predispose you to strokes. Many of those actors you spoke about had kind of different types of stroke as well.
Right.
But there are some overlap in the risk factors, and those environmental risk factors are happening at a younger age, and those are things like high blood pressure, cholesterol, diabetes. All of those things are happening at a younger age now, and so that.
So that would predispose younger people to developing.
Same factors that kind of affect older people. If they're starting at a younger age, they tend to predispose people to having strokes at a younger age now too.
For people watching, and we always like to repeat this, what is a stroke for people who are watching?
So there are two types of strokes. There's what we call the bleeding strokes, and then the ischemic strokes. Ischemic strokes are the more common kind, and those are usually caused by a clot preventing blood flow to a certain part of the brain.
Okay. Right, and so there's those kinds of strokes, but we know that they can be pretty fatal, right? I mean, we know that to survive a stroke is pretty remarkable, isn't it?
Exactly. There's over 700,000 strokes a year in America, based on the last data, and over 140,000 of them patients actually pass away from a stroke. But even those that do survive, it's often very debilitating.
Right. Yeah. So people then live with disability, which can affect quality of life.
Right.
Sounds like what you're saying is, though, so those risk factors that you just mentioned, they're largely, preventable, but also treatable, right? I mean, if you know that perhaps you have those other risk factors, you can do something about it.
Exactly.
Right?
It's hard to do anything about things like your genetics or family history, but many of the things I talked about can be identified through regular checkups with your family physician, your primary care provider. It's really important you establish that care, and they can check things and treat things like hypertension, diabetes, cholesterol, and also quitting smoking is a big factor as well.
Yeah, talk about that smoking factor, because I know, people feel like, smoking is at the root of a lot of problems. I mean, not the least of which is cancer, right? We know that, but stroke can really impact.
Stroke and heart attack, they're big factor with smoking. It's essentially causing damage to the lining of the blood vessels, makes them weaker, makes them more likely to burst, also makes them more likely to cause it increases inflammation, which is more likely to cause narrowing of those blood vessels too.
All right, what are the signs? People who are watching, what do you need to know? So how do you recognize the signs?
So the acronym we like to use is called FAST. F stands for face, so facial weakness or drooping of your face. A stands for arm, so that's either weakness in the arm or numbness in the arm, but that also includes the leg too, because that can be involved as well. And S stands for speech, so either slurred speech or also just unintelligible or speech that
like speaking gibberish, right?
Speaking gibberish, loss of grammar. And then T is for time, means call 911, get to the hospital right away, because stroke is still a very time-sensitive disease, and we have a lot of treatments that you can do to try to mitigate the level of disability or sometimes even reverse some of the symptoms if you get in there early enough.
Wow, so time really is of the essence. So if you recognize those signs, don't question, call 911.
Exactly. Don't try to drive to the hospital. Don't sit there and wait on things, because if things do get worse, sometimes we lose that window. We have clot-busting medication, which we can give you within 4.5 hours for a lot of people if they get to the hospital on time.
Okay.
And now we can even go in and remove the clot. We have surgeons who are trained to go in through the femoral artery, through the groin. They can go up there, just like you would do a catheter angiogram for the heart. You can do that for the brain and potentially pull the clot out. But it's all time sensitive. If it's too late, the neurons are dead. Unfortunately, we can't salvage anything. So.
Yeah, all right. Well, there you go, have it, folks. FAST, F-A-S-T. Look it up, learn. This is the month to learn about that. Reduce your risk, like the doctor said. Get those risk factors treated. Doctor, really great to meet you.
Pleasure meeting you as well.
Thanks for being here.
Thank you.
This is such